Okay, heart failure. You know that you have all your patients with heart failure and they're usually all on an ACE. That's part of the grid, right? Remember that grid, what you add and what you don't add. So pretty much the only thing the ACE inhibitor doesn't do is it doesn't do anything to your sympathetic nervous system. It doesn't increase your heart rate, and it doesn't increase preload, right? So it decreases all of those things. So make sure you know exactly what ACE inhibitors do, the action on heart failure. Okay. Okay, so you know the pathophysiology of heart failure. That's something that we all pretty much have seen, so you don't have to worry too much about that. There's many types of heart failure. There's three types. Most of them involve, the two main ones involve systolic dysfunction. What's the most common cause, common form of a heart failure? It's from an MI, and it's secondary injury from the MI. So whenever you have somebody going into heart failure and you think that you don't know if they've had an MI, you're going to start looking for a silent MI. Okay, and here's your left and your right. So heart failure involving systolic dysfunction may be caused by myocardial ischemia injury secondary to MI. The other thing too we don't think much about is sepsis. That's another thing. Okay, here's all your stagings and your classings, your stagings of your heart failure. Stage A, high risk to development heart failure, no underlying structural cardiac disease. Okay, treat hyperlipidemia and hypertension if they exist. Okay. So I want you to know everything that you need, everything that is red here is really what you need to know, okay? There's going to be different scenarios, and it's going to ask you what your patient is in. Okay, patients with symptoms and underlying disease are classified as, so you're going to look right over there, patients with slight mild limitation of activity causes fatigue, palpitations, dyspnea, or anginal pain, comfortable with rest and with mild exertion. That would be class C, right? These are patients that have symptoms and underlying disease. And those are stage C. I get my classes and my stages mixed up. So make sure you know that box. That box is also in your book. Okay, so here's everything you need to know, the skinny on everything. Stage A, remember to try thyroid, to treat thyroid disorders, especially if a patient has tachycardia. Stage B, you want to make sure they have a beta blocker added if they have an ejection fraction less than 40. Stage C, they need an ACE, a beta blocker, diuretics. They need to, and the diuretics reduce the preload, the control hypertension. They cause problems with the electrolytes, though we've all seen these patients, and glucose and lipid metabolism. So that's the dangers of the beta blockers. Most likely your stage C heart failure patients are also diabetics. And then start an ACE early to improve life expectancy. We've seen that now. There's been many studies, and that's what's going on. What is the gold standard to diagnose heart failure? It actually is that two-dimensional echo, and it can pick up the structural anomalies and the cardiac dysfunction. Let's see. And I told you to know class 1 recommendations for stage 1. So it's the treatment of the thyroid disorders. So I've kind of mapped out all of those things you need to know. Here's your stages again and what you do. And I've seen this on another slide, I know, because I've seen it on another slide. Okay. Some do's and don'ts. Digoxin is not the drug of choice for heart failure unless you have an audible S3. Okay? If your heart failure patient was on calcium channel blocker, discontinue fast. It's contraindicated in heart failure. Okay, remember we have those two types of calcium channel blockers. One's the rate controller and one is not. Okay, ACE is the drug of choice in most patient populations, especially over 65. And yeah, you can manage this in primary care also, but if you have worsening symptoms, progressive renal insufficiency and failure, and they're symptomatic after you've maxed out ACE, beta blocker, diuretics, refer to cardiology. Refer. Okay, and once again, all drug selection is based on comorbidities. Okay, ACE is contraindicated in pregnancy. If you have a pregnant woman in heart failure, yes, it does happen, beta blocker is the drug of choice for pregnant women. And there's your gold standard, your 2D echo. And that is pretty much it on your heart failure. Just remember with heart failure, you want to know what beta blockers do. They reduce that peripheral resistance. Whenever you have somebody who's got asthma and diabetes, you want to make sure that you're using that non-selective beta blocker. And let me see, African Americans usually benefit from thiazides before the ACE. ACE is kind of, you have to be careful because of the angioedema. And whenever you have anybody in heart failure who is on loop diuretics, you're going to make sure that you're watching the potassium and that you're also giving potassium supplementation.